order. And our first guest is Dr. Hendrix, and she's going to give us an update on all things Shepherd.
Yes, and I brought a remarkable team with me to be able to give you the precise information. But I just want to point out, I'm looking at this wonderful photo here. I think everybody sees it, of Dr. Stephen Spencer, right? Our new provost. Yeah, there you are. Oh my gosh, welcome, welcome.
Thanks.
And we will officially welcome you June 1st. I know you and your family will be moving here the first week of May. And I'll just give you this offer from everyone at Shepherd. If you need help unpacking, whatever you need, we're here.
I appreciate that very much.
Okay, well, thanks for joining us. We really
Thank you.
appreciate it.
My pleasure.
Okay, so Dr. Kelly Hart is with us to really go over a most detailed enrollment. Kelly, are you going to share the slide with everyone that you shared with me earlier?
Sharing is on.
Okay. And I think you're muted, Kelly.
Thank you, Dr. Hendrix.
Yeah.
Yeah, Cecilia, am I able to share my screen right now?
You should be, yes.
Okay. For those of you who were at the spring assembly yesterday, I did want to share with you that, as you probably know, we're in our second week of priority registration. So students are beginning to register for classes right now. We're working closely with the campus community. I did share with folks yesterday that if you know of any students who are having any financial hardships, to please get in touch with me directly, because we do have some emergency funds for these students. But I'm going to start out by saying that we just got off a 3E call this morning, the 3 enrollment marketing call this morning, and I want to share some really great news with you. I learned this morning that many of the regional state universities and state colleges are not performing well with their deposits. And Shepherd is one of the few that is performing really well. And I do have today's numbers to share with you, and please allow me to go over this information with you in a little bit of detail here. Can everybody see? Oops, you're seeing. What screen are you seeing? Are you seeing? I'm going to stop sharing that screen. I'm going to share a different screen with you.
Okay.
Sorry about that.
And while Dr. Hart's doing that, I'm just going to share with everyone that we were contacted this morning, my office was, from a proud father whose daughter is going to Hedgesville High School, and she arrived on the bus today. I think I'm looking at the bus outside my window with a lot of high school students to look Shepherd over, and he just wanted to make sure that I knew that his daughter was really interested in Shepherd, and that she's already had a lot of offers because she's a volleyball star from other places. So I called Kelly, and Kelly made sure that she went personally to meet this student and of course greet all the students. And Kelly, the father, has sent me a note, just so you know. He just can't believe that you did that. So thank you so much.
Thank you for sharing. Okay, I think I've got the right screen shared. Can everybody see my screen right now? And it should include enrollment on the left.
Yes.
Do you see that? It's got, it's a report from yesterday, and it's very preliminary data right now. So we know we have over 1,800 students right now that should be registering for courses in the fall. Okay, these are full-time enrolled students. So what you're seeing right now is that as of yesterday, we had 1,238 that had started the process. Do you see that on the screen?
Yes.
Okay, compared to 1,354. So we're going to continue to work with advisors and get these students registered. We're continuing to work with the billing office upstairs in case students have holds on their accounts for billing, reasons or other reasons. This is very, very early in the process. In fact, I kind of hesitated to share this information only because, as you can see, the date for fall 2022 is 4/11 versus 4/19 from last year. Do you see the difference there? So it's really truly not apples to apples at this point. We've got another week and then those numbers will be a little bit truer for us. Are there any questions on that piece of the slide, that section of the slide?
Kelly, are you going to give us an idea of the total number of students degree seeking and graduate, everyone?
We right now are under that 3,000 mark. I believe we're just over 2,800 students with our enrollment right now. That's total. And the goal next fall is to get us back up over 3,000, ideally at 3,100 minimum.
Okay.
Okay. I'll share with you that the really great news for Shepherd, and keep in mind right now, our enrollment is lower, right? Because if you think about it, enrollment's been dropping over the past few years. We just went through a pandemic. We brought in a smaller class this past year. And now we've implemented a strategy with re-enrollment marketing. And now we're able to get off campus and recruit students as we should. We're purchasing prospect names. We've purchased over 83,000 senior prospect names for this year, and we've aggressively marketed Shepherd University to these prospective students. And as I said, the really good news is on the right-hand side. As you can see, our application numbers, if you just take a look at the first year transfer numbers alone, we're at 1914 applications for this year, okay, versus 1378, 1865, and 1797 for the past years. According to our director of admissions, we're at the highest that we have been with our applications in the past 8 years. Okay, this is during a pandemic, and this is a time when high school enrollment is declining. So this is great news for Shepherd University. So our total application numbers are up 40%. You can see we're trending a little bit behind with our transfer numbers. We know that the transfers, generally speaking, are a slower group to go through the admission process. But the other critical piece that I want to share with you is that admissions is requiring transfer students to submit official transcripts at this point in time. That didn't happen before I came to Shepherd University. So what would happen is a student would submit unofficial transcripts, and then people had to track down the official transcripts when the student enrolled at Shepherd. And it was a very tedious process. Sometimes we didn't get the official transcript. So now we're requiring that on the front end. And admissions is also double checking this with clearinghouse data, because we also learned and have learned that some of these students may not supply us with all the schools that they've gone to with all the transcripts. And that's really important when you're transferring into a college, that you have that information. So admissions is taking a little bit more time, just double checking and make sure we have the accurate information. So that is also probably part of this, part of these lower transfer numbers. But if we move down the funnel with the admission process, as soon as the transcripts and the files become complete, admissions is making an admissions decision. You can see our total admits number is up this year. We're at 27.5 compared to last year at this time. With regard to deposits, if you look at the next section, section 3, that shows us the students who have made a deposit to Shepherd University. And then the following, the very last block, is our net deposits. We know that students deposit to multiple schools sometimes, so there is MELT. And so where we are with our net deposits is truly where we are as of today with deposits, admission deposits to Shepherd University. Okay, so as you can see, we're substantially higher than we were last year at this time. We're even higher than we were in fall 2019 at this time. So we are performing really well. We just got off the call with 3E today. We're performing 11% higher at our tracking pace that we have set for ourselves. So that's good news. And as I also shared with you, we've just learned that there are other regional institutions that just really are not performing right now. They're kind of in the same place where we were last year. So this is very good news for us. And we've also started actually recruiting for next year already.
Oh, Kelly, this is great. And I'm just going to ask, does anyone have any specific questions about this information? It will be available in the spring assembly slides to look at, but we have to appreciate that enrollment and admissions is so fluid that it changes. Kelly, I would say by the hour.
It does.
Yeah.
It does. I just heard some more good news, but I'm going to hold on that and I'll share with you next week.
That's like a little trailer tease. Okay. All right. Well, thank you, Kelly. I appreciate that. If there are no questions there, we're going to go to a really important topic that Pam Stevens is going to take us through, and that is the status of raises. And Pam, I know you're going to emphasize a point from yesterday's assembly that the raises we are contemplating and hoping that our Board of Governors approves, that is permanent and additive. It's not a one-time only bump like the appreciation bonuses. So Pam, would you like to share your screen?
Sure. So this is, let me see if I can get it to come up.
We don't see you, but maybe we'll see the.
I thought you would be able to, here we go. Let's get this up. This is the one. Share. Did that come up?
Yes, it did.
Okay, good. So let me start by making absolutely sure that everyone knows that this is, as it says, a proposal. This is in conjunction with what the governor announced before the legislature even approved it. What the legislature approved was an average 5%, and it was deemed to be $2,550 per employee. This is in the notes based on the FTE and the state appropriation at a specific date. They do that, I think it's the end of November. So what Shepherd is going to receive towards that raise is $343,001, which will offset some of the expense. They did restore the prior year reduction of 1.5%, which was $190,257. So we also got that back. All of these things help us make a case for doing what we think we need to do. We used 2,500 for this example. That is what we're going to propose to the board. And at the point in time that I did this calculation, there were 361 full-time employees. And with benefits, and that would be pension, FICA, and Medicare, that made the total increase of $1,025,691. And then for adjuncts, we don't have a set, that's a very fluid number of people and how many hours they teach. So we took a 3-year average of our total expense and gave a 5% increase to the adjuncts. And that's $1,902,668 was the payroll for the average. And so that's $54,324 added to the adjunct pay. Part-time casual, and this is part-time and casual. So those are two different buckets of employees. Part-time is regular, part-time casual is, an undetermined number of hours. We just based it on 850 hours, and having spoken with Marie yesterday, I think that may be a little high, but if we take the hourly rate of all those folks times 5%, that's another $53,518. So using those numbers, the total cost for this, or the expense for this, would be $1,133,533 for a year. And as Dr. Hendrix said, it is $2,500 per person added to their base salary, and it does not go away. That is a permanent increase. So Shepherd has to come up with almost $800,000 to make this work, and we're going to make it happen. The thing that I said yesterday at Spring Assembly, and I think it's so important, is we need to show appreciation to our folks that come in here and work hard every day. We need them to know that we value them and we want to keep them, and we don't want to have to replace them. And the other part of that is, the real truth is if someone walks out the door, we probably can't replace them for their salary plus $2,500. It would, and so it makes no sense to lose the institutional knowledge that we have on this campus and the dedicated people who have worked here for a really long time. And it's been 3 years since we had a raise, and that was also a governor mandated raise. Now, the reason that we only get such a small amount is based on what the state gives us. So they give us $12 million, and this year it's going to be just over $13 million. That does not pay our whole payroll, which is why it is so short every year of meeting these kinds of calculations. I don't know if any school is fully funded for their raise, but I know that we are about 30% funded and the rest is on us. And you can see that from these numbers. I think that it's important that we say to the board, when that last raise happened, they said, don't bring us another across the board raise. And so I think we need to say to them, this is what the governor mandated, and we're trying to comply with that, but we're also trying to do the right thing for our employees. And we want this to happen. We don't want it to be watered down. We don't want them to say, well, give it, half this year and half next year. We want it to be this fiscal year, for fiscal year 23, $2,500 for each full-time employee, and then the other adjuncts and part-time and casual increases. It won't be exactly these numbers because that number changes all the time. But I do think that it's a commitment that I feel like I have the support of ELT and everyone that is subject to get these raises. Now, we've got it scheduled to be for anyone on the payroll by December 31st. So someone would have had to work at least 6 months of this fiscal year to be eligible, with no other limitations on it. We thought about calculating the full-time employee increase on a percentage basis, but if you think about that, and my mathematicians are out there somewhere, I'm sure, 5% is on someone that makes $50,000 is way more than someone that makes $30,000. So that just continues to make the span between the lower paid and the higher paid people bigger. So this way, everyone gets exactly the same. And I think it's more fair and equitable that way. And I will do everything in my power. And I feel like I've got a lot of support here to make this happen the way we want it to happen. But it does have to go before the board. So everyone just, stand by is the best thing I can say. And, if there's anyone that that you want to talk to about this, please do so. And if you have questions, I'm happy to answer those.
I'm looking at Ken Harbaugh and I say, Ken, go ahead.
I don't think I ever received a $2,500 pay raise when in my 45 years at Shepherd, and I don't think I've ever seen it before. Across the board is definitely the way you need to go on this, because we do have so many employees now that they are hurting. I think we're all seeing those increases right now in the cost of food, housing, certainly fuel. And it hits the people that doesn't have the money extremely hard. And you're doing the right thing.
Well, thanks, Ken. I appreciate that.
we really do. And we know that some of you have personal relationships with members of the Board of Governors. And I would say now is the time to leverage that relationship just to talk about the importance of being able to keep really good employees at Shepherd. We've seen many employees leave us this year, and we know we just can't match the salaries that are being offered elsewhere. And as Pam said, it's critical that we maintain all of our essential workers. Everyone really is essential here. So now's the time. Are there any questions for Pam on this part?
Is there anything the CEC should do to help with this?
I'm going to defer to Dr. Hendrix on that. I think as she said, if you know someone on the board and you want to, send them something on behalf of CEC that the consensus is this is important and will go a long way to show our value of the staff and faculty and and even, you know, all of our part-time workers, our adjuncts, and we've gotten so many letters, 2 or 3 from adjuncts saying, please don't forget about us. We're out here. You know, please don't forget about us. And, you know, we tried to raise the minimum pay from $11 an hour to $13 an hour, which is really low. And that was primarily to benefit the people coming in the door at the starting pay rate. And 2 days later, McDonald's and Rocks and Sheets all raised theirs. So, you know, we just can't even keep up with them. And that's really sad and pathetic, because we have people that have worked here a long time and don't make those starting pay rates.
No, well, you've got, and I think they announced today, 8% inflation. I found some jobs available at the city of Martinsburg that pay in the high 30s with full benefits, requirement, GED, high school education. So, I mean, it's not keeping up with the marketplace surrounding us at all.
Right. And these are all points that we're going to be making to the Finance Committee before the entire board. So we are starting this conversation, and that's important.
I think you've heard me say before, no, but over the years, the past 8 years or so, we have slid no with our wages in comparing them to our sister institutions in the state itself. No, we need to regain some of that back.
Yeah, no, great point, Ken.
And I mean, in addition, we've lost in recent few months good people to higher paying jobs at surrounding institutions.
Right, that's right.
Yes.
Okay, so so this was really important. We have another question, focus area that Pam is going to help us with. And Cecilia, you shared this, that there's an interest in clarifying a rumor that Aramark is going to take over facilities. And when I saw that, honestly, it's the first time that I realized that that was one of the current rumors going around, but Pam said she could address it. So Pam?
Well, I will address it very emphatically that that is absolutely a false statement. There has been no communication to my knowledge, and I'm pretty sure that somebody would have to tell me sooner or later if they were even thinking about that. We just had a quarterly meeting with Aramark, and maybe someone thought there was some innuendo there. There was nothing that talked about taking over facilities. We are working hard to replace Dustin Robbins. Everyone probably knows that Dustin's leaving us tomorrow, and bringing in someone to support Shelley. And I feel like we have turned a lot of things around in facilities. There's always room to make things better, but they've put in some very great savings over there. I think that's the most unlikely prospect ever. You can never say never, and maybe someone knows something that I don't know, but I assure you that I would be aware of some kind of contract or some kind of information if it were out there, and I know nothing of this. The only thing I can tell you is that I got a call from someone who represented Compass, and Compass, I think, is the parent company of Chartwell's that we had, and just wanted to talk to someone in facilities. And so I gave the number to facilities, and I called Shelley and said, just in case you get this is the person's name, but it wasn't Aramark. It had nothing to do with Aramark. And that is the absolute only thing that I even know that had any relevance to this. And of course, Shelley says, well, why would we want to do that? We're working so hard to get everybody where they need to be. And I think that's just not going to happen. To be perfectly honest, we really can't afford to outsource. We found that out pretty quickly.
We have a very short PowerPoint presentation, so we'll try to be as concise as we can. Tammy's gonna share her screen here in a minute. First of all, thank you to everybody that participated in the survey. We appreciate it. I know that regardless of what insurance you have, it can be frustrating and stressful. we wanted to, the purpose of our survey was to find out if there is anything that about PEI or FBMC or, you know, benefits that we could help employees with. We're going to show you some of the feedback from the survey. We kept it general because we didn't want to identify specific, you know, include information that might identify specific survey respondents. So we're going to give you some kind of a big picture summary. So we had 110 responses to the survey, which I thought was really good. Of the people who responded, 91% are enrolled in PEIA and or FBMC. FBMC, as you know, that's the Mountaineer Flexible Benefits Plan. That's our dental insurance and vision and all that. 75% of the ones who said they are not in PEI or FBMC, they're on their spouses or partners plans. So here's some of the issues that were raised in the survey. There were a lot of positive comments as well as negatives. Many of the survey participants seem to be having positive experience with their insurance providers. We were a little bit surprised to see how many people said, you know, they had no complaints at all. The low cost premiums was a big thing that people liked. As you know, premiums are based on salary. So people whose salaries are lower are paying pretty low premiums. And that was something that respondents seem to appreciate. Most people felt like the copays that we have are reasonable, and they seem to be having no trouble accessing qualified primary care physicians and specialists. They commented on adequate coverage for hospital visits and elective surgeries because we're plugged in here to the WVU medicine facilities and providers. Those are really easy to use. We do have a telehealth option, iSelect MD, and people commented on that. And then the other thing was just how convenient it is to access your EOBs to see what, you know, after you have appointments and see what the charges are and the benefits. So by far the biggest complaint everybody had was Delta Dental. Specifically, a lot of dentists have stopped taking Delta Dental because according to the dentist, they say Delta Dental is not paying enough to make it worth they're like losing money on if they take Delta Dental. So we've taken some steps about that because this is a big one. Tammy has talked with PEI and FBMC. We conveyed our concerns to Trish Humphreys, the HEPC's Vice Chancellor for HR. She reached out to Jason Hart, the acting director of PEIA. And Jason said this to Trish. He said, reviews have indicated more than adequate network access, but I will advise specifically of the Eastern Panhandle concern raised in this email. This is not just in the Eastern Panhandle, I'll say, because I've talked with the folks at WVU. It's a problem for them too, and they're working on it. They do routinely put out for bids the benefits such as dental insurance, and that's going to be the dental insurance will be going out for bid for the 2024 year. So we'll stay on that because that's that's a problem for a lot of employees. You should be able to use your dental insurance. And I think what's happening is just a lot of people are dropping it. I've talked with people who have switched dentists more than once to get to somebody that will take Delta Dental. So some of the other things that people were concerned about is sometimes a patient will get referred to a facility that's not easily accessible. And sometimes the treatments are not covered at all or not entirely covered. There have been challenges accessing certain specialists because they're not in network, and Tammy's going to talk more about in network, out of network, in state, out of state. We heard that prescription pre-approval, if you have control, if you're getting a prescription for a controlled substance, sometimes it can take a while to get that approved. And then some prescriptions are not available in the 90-day supply. Some people reported having trouble finding generic prescriptions when they have a prescription that's expensive. Sometimes it's hard to find a generic for that. Some of the concerns that we saw in the survey might stem from a lack of awareness. Several respondents didn't seem to know that information about prior authorization is explained in the summary plan description, for example, or that the telehealth option exists. And that, as I said earlier, that is something that people seem to find useful. It's nice to be able to just call instead of having to go see someone. Again, as I said, Tammy will talk more about the out-of-state and out-of-network parameters. All of that's in the summary. There's a lot of information in the summary plan description, but I think that's something that people don't, just intuitively look for there. So sometimes people have to make several phone calls to resolve claims and billing. I think, unfortunately, I think that's true, whatever the insurance company is. Out-of-state services, there's a perception that those are limited. And then one person suggested that employees might want to consider using GoodRx at times, that you can get better prices for prescriptions than going through the CVS Caremark plan. So, that's something that you might look into, especially if you have a high deductible plan, because then, you'd be spending more out of pocket. So Tammy's going to take it from here.
Thank you. So this slide is just covering a couple points that we thought policyholders need to know or just remember. First, and Marie touched on this, it is important to, to read the summary plan description document and the shopper's guide that PEIA publishes, because both of these documents have a lot of really helpful information. It does take some time to get through the information because there is a lot there. As you may already know, the shopper's guide is the document that has, the plan option information, as well as the health and life insurance benefit premiums. The summary plan description document, like we were talking earlier, just has much more detail on, what's covered, what's not covered, the co-insurance for in-network and out-of-network benefits, the prescription drug benefits, how to appeal a claim, all of those kind of processes. And if you haven't already done so, we would really encourage you to make sure that you register on umr.com. And this is the site that, it allows you to print a temporary medical ID card if you need one. It's also where you would go to find participating providers who are outside of West Virginia. You can also review your explanation of benefits, as Marie mentioned. You can access those a lot quicker than waiting for that to come in the mail. So it's posted to the site sooner, so you can access that information. And there's some other tools and information, and I'll actually show you one of those in a few minutes. Another thing to keep in mind is that if you are referred to a specialist or another doctor for treatment, you want to be sure that you confirm whether or not that doctor is in the network with PEIA or UMR. And you can do this by calling UMR directly to confirm, just to be sure. Another item is out-of-state services versus out-of-network. Sometimes, these two terms are conflated, but they're very different. So PEIA policyholders can access providers outside of West Virginia for the PPV plans, A, B, and C plans. Policyholders can use the umr.com website, like I said, to find participating providers across the nation. And for services of out-of-state or non-network providers without prior approval, the plan will pay nothing unless the services are provided as a result of a medical emergency or because the necessary care is not available from an in-network provider, in which case the services will be paid at the in-network benefit level. So for non-emergent services of out-of-state non-network providers without prior approval, you'll be responsible for 100% of billed charges, and those amounts are considered non-covered services. So they do not count toward the annual deductible or the out-of-pocket maximum. So these are just things to really be careful to watch out for and just to understand the differences. You know, anyone can feel free to contact me with any questions, or if you're running into issues and you need help, and I'll be glad to help you with that. Sometimes there are situations where if I reach out to PEIA or UMR, they may not give me you know, specific information because of HIPAA or just, you know, confidentiality in general. So there are some things that I'm limited in researching or finding an answer to, but I'm certainly going to do my best to help in any way that I can. So this slide shows the chart with the network parameters as it relates to the respective coinsurance amounts that policyholders will be responsible for based on where you receive care and whether or not you get approval in advance. And this again can be found in the summary plan description booklet. And so using providers beyond the counties that are contiguous or bordering West Virginia without prior approval, that's going to result in you paying in a higher coinsurance amount. So again, it's important to pay attention to that and make sure you know whether to call to get that pre-approval ahead of time. So this slide just has a snapshot of what's called the provider search and cost transparency tool that is on the umr.com website. And it's a next generation health cost estimation tool. It allows you to quickly and easily view your costs for shoppable medical care before seeking care using provider fee schedules when available within West Virginia and in the United Healthcare network. The cost estimates are customized with your specific health plan benefits to help you make more informed healthcare decisions before seeking care, enabling you to take charge of your healthcare. So this is something that, you know, I think is a helpful tool that anyone can access, again, through the UMR website. And this slide shows a chart of all the contact information for our different benefit providers. And this is posted on the HR webpage in the employee benefits section. So you can have the phone numbers and websites for each of those vendors. And we want to encourage employees to make sure you research issues whenever you're experiencing something out of the ordinary. For example, don't assume that something is covered or that pre-authorization is not required. It's important to look for that information again, either in the summary plan description or by contacting PEIA or UMR directly to get answers to those questions. Again, feel free to reach out to me if there's a situation I can help you with. And I have included some of this information as well in the open enrollment presentation that I sent to the campus last week. And this concludes our presentation, and we'll be happy to answer any questions anybody has.
Tammy, I have a question.
Sure.
How does somebody know if they should contact PEI or UMR? For which purposes do you call one or the other?
So the phone number for PEIA is, I guess, just general questions about the PPV plan benefits. But UMR, they address questions about like eligibility, benefits and the network. So those types of questions. I know sometimes it can be confusing, but when you call, it doesn't really matter which number you're calling because they can transfer you to the right area based on the question that you have. So once you get connected to a representative, they will transfer you to the right person to address the question.
Hey, Tammy, I was confused by the slide that talked about getting pre-approval. So a lot of people go to contiguous counties such as Frederick County, Virginia, Washington County, Maryland. Do you have to do pre-approval for those? Because there was a contiguous column and then another column. So I wanted to verify that.
Yes, and that's a great question. So basically, so we should be able to go to, any provider in West Virginia and then any provider in the bordering counties around West Virginia. Now, I will say, I always caution people because occasionally there could be providers, even if they're located in the contiguous counties, that may not participate in our plan because unfortunately the providers, change all the time. They go in and out of network. Even if you look on the UMR website, they have a disclaimer that says this information is never 100% accurate, unfortunately, because of the changes that can happen. So I always advise people to call the provider, ahead of time to confirm, make sure that they participate ahead of time. So in general, you normally have to get that approval when you go to a doctor that's beyond those bordering counties. So like, for example, Loudoun County is one of the contiguous counties, but if you went to like Fairfax, for example, that's when you would have to get an approval because they're beyond the bordering counties. But again, it's just good to double check and make sure so that you don't get surprised, even if you are going to one of the bordering counties. So it doesn't hurt. It's I think helpful to do that just to be sure you don't get surprised.
There's in the chat, someone is asking, is in-state the same as in network?
Not necessarily. So let me just say, so all providers in West Virginia are participating. So I think there is a difference, but any provider you go to in West Virginia, whether it's in Morgantown, Harper's Ferry, wherever, all providers participate inside West Virginia. It's when you go outside of West Virginia that you can still find in-network providers. So that just means that they're participating in the network. And PEIA uses UMR as the third-party claims administrator, and they manage the out-of-state network for us. So it's called United Healthcare Choice Plus. So that is the network that PEIA is using for outside of West Virginia. So that's when you go to the UMR website, you have to select that specific network in order to see the doctors who are participating with us with our plan when you're searching for providers, if you need to do that.
Does anyone else have any questions? This was an excellent presentation. I would note, I noticed that we're changing back to Express Scripts after July 1st.
That's correct.
And someone asked me, that's related to me, who goes to CVS, does that mean you can't go to CVS anymore? But it doesn't, does it?
No.
Okay.
Even with CVS Caremark, it didn't mean that you could only go to CVS pharmacies. A lot of people, were misunderstood that because it's just the name of the prescription provider, but benefit provider. So.
I would really encourage everybody to carefully read the materials that Tammy provided. There are several changes this year, so you need to pay attention to it and see if there's any action that you need to take.
Well, thank you very much for taking the time to explain this to us. Next on the agenda, Heidi and I guess maybe Kelly is still there, I don't know. There's a new mission, vision, and value statement, and they wanted a few minutes to explain that to everyone.
Thank you,
Hi, Kelly.
Cecilia. I'll let Heidi take the show and go with this one.
Well, thank you. Thanks, Cecilia, for adding us to the agenda. And I'm going to share my screen. So we here at Shepherd have been working, and I think this process probably began about 2 years ago, pre-pandemic, on a new mission, vision, and core value statement. And some of you may have participated in some of the focus groups that a company called Vision Point did, also either pre-pandemic or at the very beginning of the pandemic. And we took that information and integrated it into this process. I can get the slide to it. There we go. So President Hendrix appointed the Marketing and Branding Committee, which you can see here, made up of representatives from all of the constituencies across campus, to address the question, why should a student choose Shepherd over another academic institution? So as a part of that, we started with looking at the current mission, vision, and core value statements, and have come up with proposed new statements. And what we are doing currently, why Kelly and I are here today, is that we are presenting these to all of the groups on campus. So SGA, Faculty Senate, and Dean's Council have already seen this. And then the CEC is our last stop. And what we are going to do today is show you these proposed statements, and then we'll give you a month to contemplate them, discuss them with your divisions, send me any feedback or questions. And then at next month's meeting, if Cecilia will add us to the agenda again, we'll ask for a vote of support from the CEC. To just saying that you're supportive of this, these new mission, vision, and core value statements. So the current, well, no, this is the new mission statement that we are proposing is Shepherd University, located in West Virginia's Eastern Panhandle, is a regional center for academic, cultural, and economic opportunity. We prepare students for success through innovative, inclusive, high-quality undergraduate and graduate education, interdisciplinary and experiential learning, and student-centered teaching in a highly supportive community. And I know this is the first you're seeing this, but any comments or questions just off the bat? No? All right. So moving on to the vision statement, and for those of you who might not be familiar with what the difference between a mission and a vision are, mission is who we are now, and vision is who we hope to be. So it's more aspirational. So our proposed vision statement is Shepherd University will be the region's foremost provider of academic, cultural, and entrepreneurial education with state-of-the-art learning and innovative interdisciplinary programs contributing to the community and to the success of our students as global citizens and leaders. Any thoughts on that one? All right. And then moving on to the core values. These are the 6 core values, and we have statements for each of these. I just wanted you to be able to see all 6 together. And these are the first 2. I won't read these to you. I'll just be quiet so you can read them to yourselves. Was that enough time? Yep. The next two. And then the last two. So what I'll do is forward a copy of this to Cecilia. And I also have it side by side with the current statements, so you're able to see what the changes are. And Cecilia can forward that out to everybody. And like I said, spend some time with it, talk to your divisions, and let either Kelly or I know if you have any questions or concerns. And if there's any questions right now, we'd be happy to address those now.
Does anyone have any questions or comments or thoughts on what you have seen?
It seems
Kelly, did
very
you have any?
well
Oh, sorry.
thought out. You can tell there's a lot of time taken to, I guess, include a wide variety of thought and ideas. And it wasn't just put together quickly. I mean, you can see the wording was very delicately thought about and processed before writing those ideas.
Well, thank you for that. Yeah, as a committee, we spent multiple Zoom sessions discussing the concepts and discussing what words were most appropriate. So I'm glad that that resonates. Kelly, did you have anything you wanted to add before we go?
I do not. And everybody, thanks for reviewing this information and sharing your thoughts and comments with us for the next meeting. Again, as Heidi mentioned, this vision, mission, and core value statement information is information that will be important as we move forward with our strategic plan in the future. And it's really going to give a more accurate picture of who we are as an institution. So again, thank you.